Hello there, you're watching Brass Tacks on CNN News 18. I'm Maha Siddiqui. The Omicron is fast spreading across the world. India now has 161 cases of this variant that spreads much faster than any other so far. The positivity rate due to the variant has been a cause of concern as well. Even as India is yet to forget the horrors of the second wave, the threat of a third looms large. Amidst this, calls for booster or additional dose are being made fervently. But are the vaccines that we have here in India be effective against Omicron? Is there enough data and science to suggest that boosters can help? What can we do to protect ourselves from COVID-19? That's what we'll discuss this evening here on Brass Tacks. But first, a look at the global COVID situation that has already cast a shadow over Christmas and New Year celebrations.
The party seems to have stopped in Bollywood, at least for now. The genome sequencing results of Kareena Kapoor and other stars are expected in the next 48 hours. This will reveal whether Omicron has indeed struck the glitzy world of B-Town. In the rest of the country, there's mounting trend. Monday has seen more cases being confirmed in Delhi, Kerala and Karnataka, taking the total confirmed tally beyond 160.
ओमिक्रॉन के सामने लड़ने के लिए भी हमने पहले से ही तैयारी रखी है। देश में वेरिएंट स्प्रेड ना हो, उसकी सुरक्षा के लिए भी भारत सरकार की ओर से सतर्कता रखी गई।
This could just be the tip of a growing iceberg. The only silver lining, they're all mild infections and there's no death yet. But the news overseas is grim. Omicron has brought the United States to its knees, rampaging across the masses in less than a month. The US is averaging 1.27 lakh new cases a day compared to over 70,000 in early November. New York has reported 22,000 new coronavirus cases, the biggest one-day increase on record, of which 12,000 are in New York City. Dr. Anthony Fauci has warned of a tough winter ahead.
What was not anticipated was the extent of the mutations and the amino acid substitutions in Omicron, which is really unprecedented. It kind of came out of nowhere.
Across the pond, Omicron has already become the dominant variant in the UK, with 80 to 90,000 COVID cases being reported daily. The holiday cheer in London is being rapidly doused, and anger is mounting at the UK Prime Minister and his ministers caught in the Christmas party scandal. The latest being this photo of Boris and company enjoying wine and cheese amid a 2020 lockdown. The West's war against Omicron makes it seem only a matter of time till a tidal wave hits India too.
Whenever there is a surge happening in other parts of the world, we have to monitor it closely and be prepared for any eventuality. So it's better to be prepared than to be caught off guard.
But experts also believe that while India will face a third wave early next year, it will not necessarily be so severe.
In India, there will be only a mild third wave, primarily because a very large section of Indian population is already immune. 50% of adults today have both shots of vaccine, 80% have at least a single shot. People who get infected will only have mild infection mostly.
Authorities in India are still not taking chances, whether it be in the form of genome sequencing.
कुछ दिन से केसेस बढ़ने लगे हैं, जैसे पहले रोज आ रहे थे 15 केसेस 20 केसेस, लेकिन कल 100 के पार कर गए। ये केसेस कौन से हैं? क्या ये ओमिक्रॉन है या ये पुराने वाला वायरस है, नए वाला वायरस है? अभी तक केवल एयरपोर्ट पे जो लोग आ रहे थे उनकी हम टेस्टिंग कर रहे थे। अब हमने ये तय किया है कि सारे जितने भी पॉजिटिव केस दिल्ली के अंदर निकलेंगे सबको हम जीनोम टेस्टिंग के लिए भेजेंगे।
और टाइटनिंग कर्व्स।
50% लोग उपस्थित होना चाहिए, उन्होंने मास्क लगाना चाहिए, उन्होंने सैनिटाइजर होना चाहिए, उन्होंने थोड़ा तो सोशल डिस्टेंसिंग रखना चाहिए।
But will they ultimately be enough? Ritangshu Bhattacharya for CNN News 18.
Before I go to my guest, let me go across to CNN's Elizabeth Cohen, who's joining us from the United States with more. Elizabeth, Dr. Fauci says that breakthrough infections are happening with Omicron and yet suggesting that booster doses be given. How is this suggestion being explained, Elizabeth?
It's being explained that there's a difference between being infected, Maha, and being sick. So what they're finding with Omicron, at least so far, and it's early on, is that people who are vaccinated, many of them are indeed getting sick and getting symptoms of Omicron, getting infected with Omicron, but that it tends to be milder, and people who are not vaccinated are getting sicker. So it's good to be vaccinated, 2 doses in the United States, 2 doses of Pfizer or Moderna, and it's even better to get a booster. In the United States, the directions for boosters are to get one 6 months after your second shot. Maha?
Elizabeth, is there any data suggesting that mixing of vaccines is working better? For instance, in the UK, they are suggesting taking a Pfizer after AstraZeneca shots.
You know, there's been a little bit of data on that, and really what it's come down to is that after one of the adenovirus vaccines, that's AstraZeneca or Johnson & Johnson, it is recommended by many that you get an mRNA vaccine. At least in the United States, Johnson & Johnson is not as effective as Pfizer or Moderna. So people, you know, many times people are advised, you know what, get Pfizer or Moderna as your booster after Johnson & Johnson rather than getting another Johnson & Johnson. But at least in the United States, if you get Pfizer or Moderna, there's not really a preference as to whether you get a Pfizer or Moderna booster. Really, you can do either one.
All right. Elizabeth, many thanks for joining us with all those details from the US that is already seeing a surge in the number of cases. And these cases are related to Omicron, and we are still awaiting data in India here whether the present vaccines that we've all been jabbed with are going to be effective against Omicron. Yes, these are early days. Hectic investigation research is on that count. But under these circumstances, are we sure that a booster dose will help us? That's the big question. And joining us now on the show, Shehzad Poonawala, BJP spokesperson, Dr. Isaac Bogosh, infectious disease specialist, joining us from the Toronto General Hospital. Dr. Arun Gupta, president of the Delhi Medical Council, will be joining us shortly. Reena Gupta, Aam Aadmi Party spokesperson, is also here with us. Reena Gupta, I'll come first to you. At the moment, as I'm, telling the viewers, we are still not certain whether the vaccines that we've received here in India, be it Covaxin or Covishield, are effective against the Omicron variant. So, for instance, so far in the vaccines that are being administered in India, only Sputnik has come out with their results saying that they are claiming that their vaccine prevents Omicron infection by 80%. So, on what grounds is your party seeking booster doses at this juncture?
So, Maha, we have enough experience of other viruses. The COVID virus is very similar to the influenza virus. And all of these viruses have shown us in the past that a booster dose helps. So, for example, some of the people who have received their second dose, say in April or May of this year, their immunity levels may have gone down. And there is enough evidence to show that booster doses in such cases help. So, that is all that we are saying. In places like Delhi, where the vaccination rate is very high, 99% of Delhi has received their first dose and 70% of Delhi has received their second dose. So in such cases, what we are requesting is that people who are in the high risk category, be it the frontline workers or the senior citizens or people with comorbidities who may have received their second dose very early on in the year and their immunity levels may have gone down, such people should be allowed to receive a third booster dose because there is enough vaccines in the country right now. So, but having said all of this, Maha, as far as Delhi is concerned, we are monitoring at the highest level. And the Chief Minister today took a meeting of all the high level officers. We have enough beds. We have enough oxygen. all the COVID related medicines have been stocked for 2 months. So we are ready at the highest level.
All right.
But it would really help us in our preparation if some of the population which is at high risk could also get a booster dose.
All right, let me go across to Shehzad then for more on this. Shehzad, India has enough vaccines now. Reena Gupta is also suggesting that, and we all know that because India is now in a capacity to also share or even export vaccines to other countries. For instance, healthcare workers, Shehzad, who were vaccinated earlier on in January, February this year, and as many suggest, could be vulnerable now, not just against Omicron, but other variants as well. Why this delay then to not take a call on the issue of a booster or was what's being called an additional dose in India? Why this delay?
Maha, first of all, thank you for inviting me on your show and allowing me to keep my perspective on the behalf of my party. And I hope that I'll be extended the same courtesy I extended to Reena Gupta while I make my points. I don't want to make this an issue of politicking because clearly whether or not a booster dose should be given or should not be given is purely based, as Mr. V.K. Paul has said, only on the local epidemiology and on scientific evidence. And we have an apex body called the NTAGI, which is looking at the scientific evidence. The Honorable Minister for Health, Mr. Mansukh Mandavia, has said that this decision will be solely taken by experts. He's given this commitment to Parliament. So we don't have a view against being booster doses being given, but we've left it to the scientists. And let me tell you what the scientists and doctors say, because I've got all their quotations. I've spoken to a few before coming for this discussion. Dr. Samiran Panda, no dispute about his medical capacities and his scientific mind. He has said, before jumping to any conclusions, experts should be given time to determine if India requires a booster dose or not. Okay. Dr. Manoj Singh of Apollo says that whether believing a booster dose will or will not provide 100% protection, there's still some time for that. But he proposes getting flu shots. AIMS director Dr. Randeep Guleria says there is no need for a booster dose right now. V.K. Paul says we should leave it for scientific evidence and local epidemiology to come up with the solution. And Dr. Sunila Garg, from the National Task Force, she has said something very interesting. And let me educate the viewers what she has said. She has said every geography and country is different. We in India have 70% infection. 138 crore doses have been given, which is about 60% almost of fully vaccinated and 88% of one-dose vaccination. What she says is that because there's such a high infection rate, that natural infection is also, the vaccine therefore becomes a booster to this natural infection. Okay. Now, I am not saying anything because all of these are scientific minds. Let me just complete my point. Now, I respect the Honorable Chief Minister of Delhi. I think he's a great public servant. But having done that, he has made some statements that have become very embarrassing for our country, like the Singapore variant statement, like the demand of oxygen, which was 4 times more as the oxygen audit report showed, like the manner in which he created panic in situation during the second wave. Okay. He, in fact, during the second wave, one second, Ma, let me just complete.
I'll come back to you, Shehzad. I'll come back to you. Don't worry about it. I will come back to you. We have time on the show. We have time on the show. We have 2 doctors as well.
Let me just finish this point.
All right.
Let me just finish this point, and then I promise, let me just finish this point. On 2nd April 2021, the Honorable Chief Minister of Delhi had declared that the Delta variant wasn't very khatarnak or very dangerous either. He's not a scientist. He doesn't have any capacity to make these judgments one way or the other. I would request him to focus on the mohalla clinics, which are administering drugs, which have led to the deaths of 3 children and 16 children.
Maha, you must allow me to
also focus on we will talk about that issue separately. Shehzad, I'll interrupt you there. Reena, I'll come back to you. Reena, I'll come back to you. Let me go across to our other 2 guests as well. I'll come back to you. I'll come back to you. Dr. Arun Gupta is joining us now. Dr. Arun Gupta, do you believe that the healthcare fraternity, which got its vaccines way back this year in January, February, the frontline workers, they could be vulnerable, they require a booster, and is India delaying a decision on that count?
I think first you must understand what is a booster dose. Now, booster dose is something not a very new word. On medical science, you understand that when you give primary dose of vaccination, after certain times, there is a tendency of antibodies to come down. So that these antibodies may not be sufficient enough to prevent the infection. We have been using booster dose for so many vaccines for so many decades. Now, issue is that once we know that the current available vaccines of the COVID which we have been using, their immunity level, it is going to decline after 6 to 8 months. So there is nothing wrong in considering this thing. Because we know this is not a vaccine which works for the life. Secondly, now all the studies show now maybe the primary dose may be sufficient enough to prevent serious disease, maybe hospitalization, but mild infection may become more prominent once the antibodies level decreases. Now, problem is that whether we talking about science or we're talking about the logistics. Now, scientifically, it's considered once the immunity level is decreasing, maybe healthcare workers or those immunocompromised or maybe those are elderly people, they certainly use a booster dose to boost their immunity to prevent infection. Now, the second question comes of logistics and practicality. Now, as far as Delhi is concerned, I think Delhi has given 99% people have already given one dose and 70% people have given two doses. So I don't think it's a bad idea to consider a booster dose in Delhi because they have sufficient number of doses available and their infrastructure is ready. Now, as far as India is concerned, pan-India concerned, maybe things are different because only 37% have been fully vaccinated. So their February target should be given second dose first them. Let us complete the primary vaccination, series of vaccinations.
That's a fair point, Dr. Gupta, that you're making, that we need to cover basic coverage for the entire population is necessary before we shift to booster doses. But we have the capacity to be able to do that, at least in some of the areas. For instance, as you're mentioning, Delhi. Let me go across to Dr. Bogosh, because Canada is already giving booster doses. Dr. Bogosh, are booster doses helping, at least to make the sickness mild? As the CNN correspondent Elizabeth Cohen there was suggesting that is the reason Dr. Fauci and America are suggesting booster doses, because not necessarily will it prevent breakthrough cases, but at least make the sickness mild, and that's certainly important in such a scenario.
Yeah, absolutely. First of all, I'm not going to pretend that the epidemiology in Canada is the same as in India, and obviously local decisions will be made with local data by local experts. But, I think it's fair to say that Omicron is a very challenging variant. It's very clear that reinfection is common and that infection in those with two doses of a vaccine can certainly happen with a high degree of frequency. We have to consider what the goals of vaccination are. And of course, we don't want anyone to get this infection, and we can reduce that with a third dose. Some of the data coming from the UK demonstrates the lower effectiveness of these vaccines with two doses and a growing effectiveness of the vaccine with three doses in preventing symptomatic infection. That data is obviously early and there's caveats to it, but that's pretty clear. And I think it's also fair to say that 2 and 3 doses will also help significantly prevent severe illness like hospitalization. You want to get the most bang for your buck. It's really getting in first and second doses as fast as you can. The third doses appear to be helpful, at least with Delta and growingly with Omicron. If people have the vaccines and the capability to administer them rapidly, it's a wise decision to get first, second, and third doses in. Again, I appreciate we're using different vaccines in Canada as they are in parts of India. Some of them are the same, some of them are different. So again, local expertise, local epidemiology to solve a local problem.
Reena, I want to come back to you because just before Diwali and when alarm was being sounded about why people shouldn't come together in large groups, should maintain social distancing, should keep masked up, despite the fact that many of them were double vaccinated in Delhi. The claim that was being made was that 9 out of 10 people, if I'm correct here, were showing antibodies for COVID-19. Diwali was not very long ago. Under these circumstances, what Shehzad is suggesting, that what he's picked up from some doctors is that 2 shots plus an infection in the second phase is almost like a booster dose. Wouldn't your party then agree? Because after all, it is the Delhi government that came out with the data that a large number of people are showing a sizable amount of antibodies.
So, Maha, first of all, I want to respond to what Shehzad was saying earlier. We have seen in the past also that the central government has been very slow as far as the COVID policy and the vaccination policy is concerned. When there were not enough vaccines in the country, they exported vaccines. So this time around also, we are requesting if there are enough vaccines, Maha. And also, as experts have been saying that this is not rocket science. This behavior of the virus is similar to giving booster dose for any other viral disease. So why not give a booster dose if we have enough vaccines in the country? And we will have to follow a two-pronged approach. Metropolitan cities like Bombay and Delhi, which are very crowded cities, and it has been shown that the Omicron virus spreads very fast. So these cities will have to be treated differently from, say, the hinterlands of India, where, in some places the vaccination rates are still very slow. So the government of India cannot say that let's vaccinate the whole country first and give a booster dose only once we vaccinated everybody, given everybody a second dose. It'll have to be a two-pronged approach. We'll have to do both the things at the same time because there are enough vaccines in the country. So why deprive the people who are living in crowded areas a booster dose if the capacity, the infrastructure exists and the vaccines exist? Why not give them a booster dose?
No, my question, Reena, was that is this matter now political in nature? Because at the time of Diwali, it was said that people have enough antibodies. Now, when there is a real alarm that we could be headed towards a third phase, the suggestion is that the central government needs to do more.
Maha, the virus, as we are seeing, this virus is spreading very, very fast. So in order to reduce the impact of infection, I think a booster dose is a very good idea. And even though the seroprevalence in Delhi is very high, but again, this is old data. And as some other expert was also saying that some people would have received their second shot in March or April. So, several months have gone now since March, April, and their immunity levels would have gone down again. So why take a risk when we have these doses available in the country? What's the problem in giving a booster dose to at least the frontline workers?
Dr. Arun Gupta, I want to come to you before I go to Shehzad. The question is, Dr. Gupta, that if
please can I respond?
Yes, Shehzad, I'll come to you. I just want a quick reaction from the doctor on the panel. Dr. Gupta, help us.
But it's becoming a little unfair because...
Just a second, Shehzad, I'll come back. I'll come back to you, Shehzad. We have time on the show.
If you give me a word in, I don't like interrupting.
Dr. Gupta...
Okay, I hope you'll give me enough time
I'll come back to you. Dr. Gupta, the question is, do the cells have memory? Will they be able to make antibodies? There are lots of issues that go into deciding whether a booster is required or not, and who decides who requires a booster. At the end of the day, an individual's body may have the capacity to form antibodies and somebody else's might not. So what is the basis on which we will decide that, Dr. Gupta?
That is right. When you said that the 90% of people of Delhi have been exposed to the COVID virus, that means their body has the antibodies. But is this body antibodies is good enough to prevent infection? That is again the question. The being only positive to the antibodies doesn't mean that you are totally protective.
Okay.
Now, once you give a measured dose of the vaccine, then you elicit certain response. Your antibodies level will be good enough to prevent infection as well.
Okay.
So that's why vaccination is actually required, even if in wake of natural infection.
All right, Shehzad, now you can come to your point, because Dr. Gupta is also suggesting that a booster may be required at least for a certain section of people.
Okay, now Maha, since I did not interrupt anybody, please make sure nobody interrupts me. Let me address one point at a time. First of all, those who say that we have been very slow at administering vaccines, I don't want to boast about my country, but yes, in the last 3 months, we have administered 60 crore vaccines. That's twice the population of United States and 5 times the population of United Kingdom. We started a month after United States and we've administered much more vaccines than them despite our constraints with resources. And this is the first time a vaccine was developed simultaneously globally and in India, unlike vaccines of the past, which took decades to come into our country. So I'm very proud that our country has run the largest vaccination drive, mostly free of cost, and has done it at an excellent pace, because of which we've covered 88% people with 1 vaccine dose. Now coming to the other points. The scientific community is not one mind about booster dose being administered. The BJP or Shehzad Poonawalla has no view on this. We have left it to the scientists. But I was reading Nature's magazine, and the Nature's magazine article, which was detailing scientific research on it, said that even if we were to administer a booster dose, how long it gives protection for is not known. So whether it ends at 3 or we go for 4th, we don't know. Even Nature's magazine is saying that. And therefore, I am agnostic to this. I'm leaving it to the scientific community. As Dr. Isaac said, the local epidemiology has to decide this. The one thing the scientists are one mind about is this thing. the masking that we need to follow, the COVID social distancing that we need to do, and also, may I say, as an individual, I feel that we should also not have vaccine discrimination. What is vaccine discrimination? This means that if somebody has not even got access to one dose till now, they should be denied that access, and somebody who has got a fully vaccinated should be given a third dose. Let's not lead to vaccine apartheid. The poor of this country also deserve a shot of hope as much as the rich in this country deserve. So I would suggest to you that let's look, we are not saying
fair point
one
being
last
made
point.
there, Shehzad.
Dr. V.K. Paul,
Shehzad, we are running out of time. Let me go to Dr.
V.K. Paul has assured.
We have the last 1 minute left. Dr. Bogosh, that's a valid point that has been made about vaccine inequity. And we are not seeing it here in India alone. This is a global phenomena, sir, where we have seen poorer countries not being able to vaccinate their population. Is this the very basis of new variants coming out? And do we need to work on that before looking at booster doses for rich countries?
I think you can walk and chew gum at the same time. If you have tremendous supply, you can certainly contribute to global vaccine inequity and in a very positive light, but you can also provide third doses for your vulnerable populations or for your population in general. And if the whole world really does contribute to vaccine inequities, we will be much further ahead. If you want, like I mentioned before, the biggest bang for the buck is getting first and second doses into unvaccinated people. And millions of people remain unvaccinated.
Yes.
That should be the big priority. Third doses will probably help. 3 are better than 2. And we have to think about a global response as well.
All right. We'll have to leave it at that. Many thanks to all of you for joining us here on the show this evening on Brass Tacks. That's all that we have time for at the moment. Many thanks for joining us. Bye-bye.